What issues do you think you're still facing in the future? Are there any barriers or problem areas you think I need to get on top of before I'm back to my normal self?
Well, going out of the house on my own is a major thing at the moment. And because obviously, if I do go back to work, I've got to get there and back. So that is my major issue at this moment. But that is the next thing to be tackled with the cognitive behavioural therapy.
Yes. So there's a few barriers there, but I get the sense you're still pushing yourself a little bit.
I have to, because nobody else does it for you.
I agree with that, but by the same token, is there anyone else around you who's actually on your side and helping?
Absolutely. I've got a very, very supportive husband. I've got a very, very supportive sister and a very supportive father.
So you've got some family support around.
Absolutely. They're brilliant. And a really good son and a daughter that have never brought me any trouble. And they support me very, very well as well.
Have you seen any particular issues regarding your physical health or mental health issues for the family, how they've managed?
I think it's been hard. Richard has somebody come round from the Rethink.
Yes.
So he can offload onto them. But it's very, very hard. I know how wearing it is living with somebody with mental health issues, even, and then getting a cancer diagnosis on top. You know, poor old Richard, I don't know how he's coped with it, but he gets his sort of release by having somebody come round so he can offload. And he's also very kindly gone along to on a course to learn about that Rethink run, to learn more about mental health and medication and stuff like that.
Well, that's great. That sounds like a useful resource out there if it's accessible.
That's right, it is, yeah. So, you know, Richard does get support, but it is hard. It's very hard for the whole family, you know, because, you know, when you're actually in the pits, you're very needy.
Well, I was about to ask you, imagine the situation of somebody coming new to a diagnosis of breast cancer or another cancer, and they have a past history of depression. What would you say to them about how to manage the next few months or even few years?
I would access as much support as you can from you know, like yourselves, psycho-oncology or whoever is out there to support you. Use breast cancer care. There's places like No Panic that you can ring. Just use everything that you can possibly use, because all these things are a huge support, and it does help you get through, you know, from day to day, because there are people out there. And I would just say, you know, just remember that we can be a little wearing on other people. So, you know, so sometimes we have to give them a break.
That's a fair comment.